Hello, my name is Diana Mustika Widiastuty and welcome to my video. In my video, I want to explain about depression. So watch it. Depression. Depression is a mental health disorder characterized by a mood that constantly feels depressed or loses interest in activities, resulting in a decrease in the quality of daily life. Depression occurs because of the pressure felt continuously and total suffer and the feeling that they are alone, especially when they are at the lowest point. This causes stress, anxiety, fear, and ends up leading to depression. And I have the video, so let's watch it.
I've lost all hope. There's nothing left for me.
What is this, Diana? What kind of offer are you giving me? If you don't want to do your work, just let me know.
Why does everything feel like it's against me? It's like I'm colorblind and constantly being told how colorful the world is.
Then let's take a picture.
Okay. Smile.
Hey Diana, welcome back. How's everything? I hope you're doing well. I heard you had a rough
Nothing can
accident
save me
last
from
time.
this.
Are you okay? Really?
I'm useless. Nobody wants me. Why can't I do anything right? I'm always alone. I'm not good enough. I can't take the pain anymore. Point of even trying wants all I do is fail. I can't do it. I'm not good enough for anyone. I'm always alone. To end this. Depression draws near once again. You see, the thing about depression is, I'm not afraid of dying. I'm afraid of living. Depression is like a war. You either win or die trying.
Here are the symptoms of depression. The first, always feeling guilty, feeling nobody can understand their feel, feeling hopeless, inferior, and worthless, feeling anxious and worried too much, bad mood or sad ongoing, easily angry or sensitive, not interested or motivating about everything, always feeling tired and lost energy, sleep disturbance, change in body weight and appetite, and the last is the mind urges to hurt or kill themselves. And here are the type of depression.
Depression is a very misunderstood disorder. People will tend to stereotype depression and make it seem as though you are typically sad all the time and hate the world, but that is far from the truth. Depression has subdisorders that will have different symptoms, intensities, and causes. Here are the different types of depression. Disruptive mood dysregulation disorder. If you tend to have continuous outbursts of temper, either physical or verbal, and it happens 3 times a week, that is one of the symptoms for disruptive mood dysregulation disorder. Other symptoms that you could experience are feeling sad or moody besides the anger 3 times a week, or having severe outbursts. It's more likely that you have this disorder if these symptoms have occurred for more than a year, or if the symptoms started before the age of 10. Another subdisorder of depression is major depressive disorder, which can also be known as clinical depression. Those with this disorder may have an episode for longer periods of time, while others may only have had an episode once in their life. People with MDD have the following symptoms for nearly a 2-week span, and it will usually arise every day. Feeling hopeless, sad, or numb. Decreased motivation for things that they used to like. Increased or decreased appetite, which could lead to weight gain or loss respectively. Changes in sleep. Fatigue. Being unable to concentrate. Forgetfulness. Thoughts of death or suicide. Suicide attempts. And self-harm. MDD can be mixed with different disorders like anxiety, melancholic features, catatonia, peripartum onset, psychotic features, and seasonal patterns. Persistent depressive disorder, also known as dysthymia, is an ongoing depressive disorder. The symptoms are not as clear as MDD, however the symptoms usually happen almost every day for 2 years in adults and at least 1 year for children and adolescents. The symptoms that go along with dysthymia are appetite change, change in sleep cycle, low energy, poor self-esteem, feelings of hopelessness, bad concentration, forgetfulness, and lack of motivation. Dysthymia can be mixed with other disorders just like MDD. It can also range in levels of severity. Premenstrual dysphoric disorder is disabling approximately 3 to 8% of women, and no one can really figure out why. The following symptoms occur during the menstrual cycle, and a usual diagnosis would require at least 5 of the following symptoms to be present. Mood swings, increased sensitivity, feelings of hopelessness or being overwhelmed, anxiety, feeling tired and sluggish, a lack of interest in activities, and insomnia or excessive amounts of sleep. The disorder also has physical symptoms, such as joint pain, bloating, weight gain, tender breasts, and swelling. This disorder will affect school, work, and relationships. Substance medication-induced depressive disorder. This disorder is present during the use of medication or during substance abuse. Symptoms include irritability, depressive episodes, bad temper, a sense of hopelessness, and no interest or pleasure in anything. These symptoms will occur when using the substance or when in withdrawal. Most people use drugs or substances to feel better and will usually not notice the symptoms they have for substance medication-induced depressive disorder. Depressive disorder due to another medical condition is another type of depression. Arthritis, diabetes, HIV, strokes, viral infections, and much more can cause you to have depression. Symptoms can include a persistent depressive mood, lack of interest, irritability, and an elevated or expansive mood. We hope this helps you out. If you experience any of these symptoms, please see your doctor or find someone you trust to talk.
Depression have complication, and there is being overweight or obese, which can cause heart disease and diabetes, physical illness, runaway in the form of alcohol or drug abuse, anxiety, panic disorder, or social phobia, cause family conflict, relationship difficulties, and work or school problems, social isolation, paralysis of suicide, attempted suicide, or suicide, the desire for self-mutilation, early death due to medical condition. Here's the difference of stress and depression. Stress pleasure can encourage you to be more motivated to face challenge, but it can also break your spirit. The reason is each person has a different mechanism in dealing with stress. Some people will get used to be more able to cope with stress than others, but if not effectively overcome, stress can lead to depression. Depression is a mental illness that has a negative impact on various aspects of the sufferer's life, starting from the mood, feelings, stamina, appetite, sleep pattern, to the level of concentration. People who are depressed can feel sad and fear, get tired, easily lose enthusiasm or motivation, even suicidal thoughts. This condition must be dealt with carefully so as not to end fatal. And how to deal with depression? If you are through depression, first, look for things you like. Next, try new things that can distract negative thoughts. Keep on doing activities to maintain hope, such as exercising outside, especially in the morning. Try to be grateful, find a place to pour out your heart, maintain balanced nutrition, or you can, if necessary, go to a psychiatrist. If depression is alert and you want to help it, first pick up information on why they are depressed and continue to accompany them. Understand that depression is a disease. Don't judge them. Understand that their nature when depressed is not their true nature. Express attention. Take care of one's physical and mental condition as well. Persuade to see an expert to help, and continue to support them to get well. That's all my video. I'm sorry if I still have many mistakes in my video. And thanks for watching, and see you next time.